that something needs to be done, even if it's not very instinctively conservative. But would her solution work? I'm joined by Lord Warner, former Labour Health Minister, now an independent peer, and Niall Dickson, the Chief Executive of the NHS Confederation. Lord Warner, do you buy the death tax, the inheritance tax idea?
Well, it's not a bad idea to get some money after death from care. This just won't deliver the bacon that we need in terms of the funding for social care. 500,000 deaths a year, under 5% of those people paid inheritance tax. So something very dramatic would have to be done, way beyond what Camilla was talking about, to get the kind of...
What's the number we need? I mean, 2 billion's been cut, I think,
well,
in the last few years.
we need 2.5 to 3 billion up to 2020. I mean, just to plug the gap that's been created. If you look at what goes on with demography over the up to 2035, I mean, you need 2.5% new money each year, right, all the way for 15 years.
Neil, inheritance tax, death tax of some kind, good idea?
Well, I think you need something to bring the money in, and I almost think that Camilla's piece underestimated what we're now facing. We're talking about, at this moment, 1 in 8 elderly people in England not getting the services that they need, that they're needing to be dealt with. These individuals are suffering at this moment. We've got a healthcare system that's under enormous pressure. So I think there has to be something done in terms of, as Norman says, in terms of the immediate. The longer term issue is we're going to see a doubling of the over 85s. So politicians have got to face up to this. This is a moment to actually reflect on something really serious that has to be dealt with, both in the immediate term and in the longer term.
But you talk to them in your job as chief lobbyist for the NHS and all that. Are they taking it seriously? Because in a way, the next 2 weeks is the best chance we've got, which is when the two parties, the parties that might govern, write their manifestos. Isn't that when it has to happen? Are they putting something in there?
Well, we'll see what they actually do put in. I think it's fair to say that the Prime Minister has rather nailed her colours to the mast by saying she is going to deal with social care. Now, that promise has been made before by previous administrations. I am told that she is deadly serious. She is going to do it. But the issue is it's going to cost money now. The government did put more money in the budget, and it's going to cost a lot more money going forward. Now, some of that can be raised by taxing individuals, or it could be done by building up funds or whatever. But over a period of time, we should be starting to link it to the GDP level. We should be putting health and care together, because care tends to lag behind health. Health gets the headline, but then health suffers because care is not properly funded.
Lord Warner, do you like the idea of a hypothecated tax, a tax which is, this tax goes to social care, which is not what our taxes normally do, obviously. They just go into a big pot.
We had a look at this on the Select Committee on the NHS sustainability. It's quite clear that people don't trust politicians anymore, so in terms of taxation. So I think you're going to have to look at a stream of revenue for social care at the very least, which is clearly defined, and that's what they've done in Japan and Germany. They haven't ditched general taxation, but they've topped up general taxation by actually having effectively a hypothecated tax for long-term care. And I think we've got to start thinking in those terms if we want the stream of revenue to be adequate.
What about non-tax solutions to this? I mean, what happened to the idea of insurance, or whether an insurance that would take you up to a cap and the state would pay over?
Well, the Japanese and German systems are a real fund. They're different from a hypothecated tax in the sense that you just pay the money and government says it's going to that amount. This is a real fund that they're building